that there's a big element that is missing there, which is the lack of specific actions regarding the introduction of harm reduction services.
The province of Manitoba has released its 5-year plan to help strengthen its response around community wellness, mental health, and addictions. But some experts say key elements are missing.
Overdose prevention sites or safe injection facilities or safe consumption places are something that needs to be taken into account by every community that needs to really address overdose.
Dr. Jaime Arrondo is a Canadian research chair in substance use and health policy research. He's done extensive work in the field of harm reduction and says the omittance of it in the plan is shocking.
Lives are getting lost. This is a trend that is not unique to Canada. It's a North American trend. Also, Mexico and the United States have seen during the pandemic their overdose rates increase to never heard before levels. So it's really like all hands should be on deck and every action should be considered.
Arrondo says government needs to take its lead from those on the front lines of the crisis. Beyond offering a place to safely use, supervised injection sites also provide low barrier access to care.
We are trying to enhance system navigation to try to detect those people who might be in need of treatment. There's no better place than those sites, right?
The Manitoba plan will see an almost $24 million investment into community wellness, focusing on equitable access to care, improving service quality and innovation while working with Indigenous partners.
I'm really disappointed that this report doesn't highlight the things that the community has been not asking for, but demanding for years and years.
Johnny Mexico is with the Manitoba Harm Reduction Network. They say despite the fact community members told the government there is a need for things like a supervised consumption site, a managed alcohol program, and drug testing, they were left out.
So there's a huge strain on our system right now. It's not getting better, it's getting worse. No mother needs to lose another child to an overdose crisis or to a poison supply crisis. We should be way ahead of this by now in our province and in our city. And the fact that we're not is super disappointing.
Manitoba's Minister of Mental Health says the plan is just a framework.
It's flexible enough that as we learn more about the Manitoban needs and how models can work effectively here, we can add those in future years.
The minister says they are addressing funding issues and stressed while some specific ideas are not being implemented at this moment, they could be in the future.
But that doesn't mean that they're out of the report or that they're out of the conversation, right? We have a lot of work to do. It's going to take years to address the needs here in Manitoba. We recognize that there are a number of harm reduction strategies and tools, and we will use the ones that are most effective to address the needs here.
Guillemard says her heart is also with those who are struggling right now, and while community wellness is a priority for her government, it does take time.
I would like to have this done yesterday, obviously. There is a process to follow. We have to make sure we're doing it right. We have to make sure it's effective and sustainable, and to reach those who are in the highest needs areas.
In Winnipeg, Morgan Majeski, City News.